Hi everyone. So you're welcome to the second video within the hypertension series on Dr. Mira Teaches, and we will be looking at the blood pressure equation. I know anytime you hear the blood pressure equation, all you do is see stars, but do not worry. I'm here for you, okay? So just calm down because I got you, right? So I will give you a mnemonic that is going to help you to remember the BP equation. And this is the mnemonic. You know that rich auntie called Beatrice, who we usually call Auntie B just by the first letter of the name, Auntie B, right? So that's what the B stands for. So B and P, P also stands for someone's name. So B and P came out as survivors, right? So that's the mnemonic. B and P came out as survivors, okay? B and P came out as survivors. So I put it on this slide, quite a number of times so that you'll be able to remember it, have a photographic memory. Okay, so B and P came out as survivors. Before we move on, I just want to tell you that whatever you do, please survive. No matter what situation you are going through, please survive. Do not give up, no matter how tough. Okay, hustle your hustle, grind your grind. Cry the tears out, wipe them, and then move on. Okay, don't let anything break you down completely. You are very strong. You will survive. You must survive. You must come out as a survivor. All right. Okay. So blood pressure is equal to cardiac output times systemic vascular resistance. That's the BP equation. Blood pressure is equal to cardiac output times systemic vascular resistance. So BP is equal to cardiac output times systemic vascular resistance. So this is the popular BP equation. How does it relate to the mnemonic? So B and P, so BP, all right, is equal to, now we look at the highlighted letters within these words, all right? So came out, so the C and the O stands for cardiac output. Okay. Then SVR stands for the survivor, which is systemic vascular resistance. Systemic vascular resistance. So that's how it relates. So BP is equal to cardiac output times systemic vascular resistance. Okay. So that is the BP equation mnemonic. And this was genetically engineered at Dr. Mira Teaches. Right. So please subscribe. Okay. All right. So we've seen it. BP is equal to cardiac output times systemic vascular resistance. This is the blood pressure equation. But you need to understand the various elements of the blood pressure equation. So let's understand what cardiac output is. Okay. When you hear cardiac output, you see stars. But of course, I'm here for you. I got you. So just calm down. Let me explain it. All right. Now, let's play with words. When you hear the term output, okay, you just need to flip it around and you'll be able to understand what it means. Output means to put out. Very simple. So, what do you put out of the bladder? Urine. What do you put out of the uterus? A baby. What is the output of the breast? Milk. What do you put out of the nose? Phlegms. I didn't want to say nasal secretions, it's too polished. So, phlegms. Okay. And then finally, what do you put out of the heart? You put blood out. Okay, so the output of the heart really is blood. Okay, so I'm driving at a point. Now let's look in the dictionary. Okay, the definition of output is the amount of something produced by a person, machine, or industry. So the key word here is amount. The amount of something produced by a person, machine, or industry. Remember, the heart is a machine. All right. Now, we saw that the output of the heart is blood, right? But we do not say heart output. What we say is cardiac output. Juicy. So that's where it comes from. We don't say heart output, we say cardiac output. Now, when you're looking at output, you are not just looking at the fact that it is blood that comes out of the heart. You have to look at the amount and the time factor. Okay, so cardiac output is the volume of blood the heart puts out in 1 minute. So we've seen the amount and then the time factor. Cardiac output is the volume of blood the heart puts out in 1 minute. And for an average 70 kilogram person, that's about 5 liters in 1 minute. Okay, so if somebody comes to you in the hospital clinic, you can estimate, oh, this person will have a cardiac output of about 5 liters in 1 minute. That's a general rule for the average adult. All right. Okay, so that's cardiac output. Maybe you don't really get it. So I want to go through a stepwise procedure that will help you get cardiac output. Now, please do not try this at home, at school, or anywhere. Try this only in your mind, in your imagination. Okay, so what do you have to do? All you have to do is to place a measuring cylinder beside the heart and find a way to collect all the blood that passes through the aorta. All right, find a way to collect all the blood that passes through the aorta. You also need a timer. Okay, so get a timer and place it by the heart. Now, what do you do? Let's set the timer to 1 minute. All right, we set the timer to 1 minute and we'll measure the volume of blood that the heart puts out within that 1 minute. So you set your timer to 1 minute, get a measuring cylinder, put it beside the heart, try and find a way to collect all the blood coming from the aorta and wait. Once 1 minute is up, just measure the volume of blood within your cylinder, and that is your cardiac output. Do you get it? So it is the volume of blood the heart will put out in a minute. All right, so that's cardiac output. I hope it's clear. All right. So we've seen the blood pressure equation. BP is equal to cardiac output times systemic vascular resistance. And we've defined cardiac output. Let's define systemic vascular resistance as well. Systemic vascular resistance just refers to the opposition to blood flow. Anything that will hinder the free flow or the smooth flow of blood is systemic vascular resistance. All right. And it depends on these three: the diameter of the artery. So if the artery's diameter is small, the internal diameter of the artery is very small, it's much more difficult for blood to flow easily, okay, through the artery. All right, so that will increase the systemic vascular resistance. Okay, so the heart now has to work harder to get blood to go through an artery which has, a smaller internal diameter as compared to one that is very big. That one, the blood can flow very easily, you see. All right. Now, when the blood is also very thick, okay, so that's blood viscosity. Blood cannot flow very quickly and smoothly. Imagine honey. You see the way honey is very thick and viscous. When you pour honey out of a bottle, see how slowly it flows. Yes. So that causes an increase in systemic vascular resistance when the blood is very viscous. Okay. Then the length of the artery. So now having a longer distance at which the blood must flow versus a shorter distance, you realize that the heart will need to work harder to get blood to travel a longer distance as compared to traveling a shorter distance. Okay, so the length of the artery, all right, if it's longer, it increases the systemic vascular resistance. In all these three cases, the heart will have to work harder to get blood moving. Okay, so this is what systemic vascular resistance is about. Anything that will hinder the smooth, quick flow of blood is systemic vascular resistance. And usually, we like to center around the diameter of the artery, especially when it comes to hypertension. Okay. Again, blood pressure is equal to cardiac output times systemic vascular resistance. We've seen cardiac output, we've defined systemic vascular resistance. And I found this beautiful image online, and it came from this book, Clinical Physiology Made Ridiculously Simple by Stephen Goldberg. All right. It says that it tells you what the blood pressure equation is, but in a picture form. So blood pressure is equal to cardiac output times systemic vascular resistance. All right. It's also known as total peripheral resistance. So anyhow you like to call it. Okay. So anything that increases your cardiac output or increases your systemic vascular resistance will lead to an increase in your blood pressure. All right. So we've looked at the blood pressure equation. Let's narrow it down to the cardiac output equation. All right. So let me give you the mnemonic again. We know that B and P came out as survivors, but what did they survive? What did they survive? They came out of a heart attack and stroke. So that's what they survived. They came out of a heart attack and stroke. So B and P came out as survivors, but they survived a heart attack and a stroke. Okay. So That is the mnemonic for the cardiac output equation. So what is the cardiac output equation? Cardiac output is equal to heart rate times stroke volume. Heart rate times stroke volume. Cardiac output is equal to heart rate times stroke volume. Let's see how it relates to the mnemonic. So cardiac output, CO, all right, is equal to heart rate times stroke volume. All right. So the first letters of the highlighted letters in came and out will give you the cardiac output, then heart for heart rate, then stroke for stroke volume. So they came out of a heart attack and stroke. So that's how you remember the cardiac output equation. In it. You only get this on Dr. Mira Teaches. So please subscribe. Okay. All right. Let's look at what stroke volume means. Now, let's go back to the dictionary. Stroke means it is an act of hitting or striking someone or something. That is a blow. Okay. So if you look carefully, you realize that the word stroke comes from the word strike. You see, and strike means to hit someone. You can say, I received 3 lashes. Instead of saying I received 3 lashes, a more fancy way to say it is he received 3 strokes of the cane. I received 3 strokes of the cane. That's more fancy. And if you look at the synonyms, it means to blow, to hit, you see, to smack, to slap. So that's what stroke means, the act of hitting or striking something. Look at this beautiful little girl. She's hitting, she's striking, she's stroking the drum. All right, she's making beats by stroking the drum. And we also know that the heart also beats. It makes a very nice sound, lap dap, lap dap, lap dap. Okay, so we can say, instead of saying the heart is beating, we can actually say the heart is stroking. Okay, it is giving us the nice sound that we hear, lap dap, lap dap, lap dap. All right. Now, let me give you the procedure for understanding what stroke volume is. And this is even simpler, right? Same items, you need the same items, all right? Okay, you just need a measuring cylinder, all right? So you need a measuring cylinder and then your heart. Find a way to collect all the blood that passes through the aorta. Remember, don't try this at home, at school, or anywhere. It's only in your mind, okay? So you find a way to collect the blood that passes through the aorta into the measuring cylinder. And then you measure the volume of blood that the heart will put out with one beat, one stroke. So just one pumping action of the heart. That's all that you need. And then you measure the blood volume. You are not going to use a timer. You are not going to wait for 1 minute. Okay. So the moment the heart pumps, it will release some blood, isn't it? It will push out some blood. It will put out blood. You just have to collect the volume of blood the heart puts out with that one stroke or that beat, and that would be your stroke volume. Okay, so you see how it differs from the cardiac output. Cardiac output, you measure it in 1 minute, but stroke volume, you are just taking the volume the heart puts out with one beat or one stroke. That is why it is called stroke volume. Okay, with one stroke. So you write it down. That's your stroke volume. Okay, so yeah, stroke volume, very simple. Let's define heart rate as well. So this time you need a timer, but you do not need a measuring cylinder. You just place the timer by the heart, set it to 1 minute, and measure how many times the heart strokes or the heart beats. Okay, so the number of times the heart beats or strokes in 1 minute is your heart rate. Okay, so this is a summary slide to tell you the definition. So stroke volume is equal to the volume of blood the heart puts out with one stroke or beat, you see. And heart rate is the number of times the heart beats or strokes in 1 minute. So it's very, very simple. This bonus slide tells us the two main drivers of hypertension are the sympathetic nervous system and then the renin-angiotensin aldosterone system. Do not be confused. I'm just giving you a teaser for the next video. Okay. Now, the thing with hypertension, the pathophysiology of hypertension is that if you observe very carefully, okay, everything sort of boils down to the sympathetic nervous system and the renin-angiotensin aldosterone system. right? Of course, you have to also look at the components of the BP equation as well. So this is just a teaser, I just want to tease your taste buds for the next video. So please don't miss the next video, all right? Okay, so thank you so much for sticking till the end. Please remember to survive, okay? I love you all. Bye bye.